Welcome to the Parent Matters podcast, where we help you navigate the ever-changing landscape of parenting and equip you with tools to confidently parent your children. I'm Susan Stutzman, and today we're going to talk about when to consider seeking services for your child from a psychiatrist. And to help me do that today is Dr. Elizabeth Bernardino, Child and Adolescent Psychiatrist in Burr Ridge, Illinois. Thank you for joining me, Elizabeth.
Well, thank you very much, Susan. I really appreciate you thinking about me and asking me to be part of your Parent Matters podcast. It's really a privilege. Thank you.
Well, thank you. So I'm so glad that you're joining me because I think this is a really important topic for parents to begin to think about, especially in our day and age where children suffer from issues that sometimes have been in the past not as talked about or as public. And so as parents are navigating mental health issues, I think that it's important to think about different ways that they can support their child. And one of those is through seeking services from a psychiatrist. And I am really excited to have you here. But before we begin, what I want to say is that the study and treatment of emotional disturbances and mental illness and abnormal behavior through the lens of medicine and a medical doctor is really the specialty of a psychiatrist. Is that true?
It's very true.
Mm-hmm. And so different than a counselor like myself or a psychotherapist, you're treating by listening and utilizing medicine, where my treatment is listening and utilizing skill building.
That is right. Mm-hmm. But most important for us in the field is diagnostics.
Okay.
Diagnostic is very important because that would drive the treatment. It does not have to be medicine all the time. Some of the patients that we see could benefit from counseling period. Mm-hmm. But it is important to have a good formulation, a good idea of what is being presented, why. So it is important to look at the biological, psychological, social background for any of the patients that we see, and such understanding would drive the treatment.
Yeah. And one of the things that I really appreciate about Dr. Bernardino, your practice, is that you are very careful to spend a lot of time with the patient and in the initial interview to seek to understand what is going on with their biology, with psychological, with any type of environmental issue, so that you are uncovering what might be adding to the reason that they're presenting, the problem that's bringing them into your office. So why don't you tell me a little bit about your journey and how you got to where you are today? What drove you into the field of psychiatry, and especially for children?
Well, I have been in practice for over 30 years. And I remember even as a second-year medical student that this is the field that I wanted to go into. So after 4 years of medical school, I decided to go into the training for general psychiatry, and that's 4 years. I was in private practice for 2 years, and I realized that if I could intervene earlier on among children and adolescents, perhaps that the challenges that an adult face could be minimized. And so I went back to do 2 more years of child and psychiatrist, child and adolescent fellowship. That's what they call fellowship. And I'm glad I did. So even up to now, I still work with adults, including geriatrics, 65 and over, but mainly with children and adolescents from age 5 to 18. That's been the focus of my practice in the past, in about 30 years or so.
Wow. Yeah, that's a lot of experience. And I don't know if this is the same across our different practices, but I know that if you can understand the workings of a child and being able to treat a child, you can pretty much treat a large swath of the population, because oftentimes, like what you were mentioning, if you're an adult, you might be dealing with something that started in your childhood. And so I'm curious if you find that, because you said you can treat adults and geriatrics, but that your primary focus is, children and adolescents, that you can see anybody, because a lot of mental issues that are in childhood are very complex, and they kind of like, if you see a child, you can see anybody.
Well, it's actually, Susan, the training that we had for 4 years, the first 4 years, was focused on teenagers and adults. So
Okay.
that was what we were trained during the first 4 years. And then the 2 years was really more subspecializing with children and adolescents. I think that my practice, I would speak for myself that my patients are mostly children and adolescents, and in a way it's by default, really, because not a lot of psychiatrists want to deal with this population,
Yeah.
and frankly, they shouldn't, because you really need to have that basic knowledge, but at the same time experience in terms of developmental stages
Yes.
in with children and adolescents. Also, you're looking at different systems. When you're working with children and adolescents, you have the child, of course, the parents, sometimes the grandparents are involved, and sometimes school and the court. So there's so many other systems that you have to really try to weave in, and that by itself would take time and patience and broad understanding of what we're dealing with, what we're treating. So it's a little bit more complicated in that way. I mean,
No, and I didn't mean to overgeneralize
Yeah, no,
it,
yeah.
but there is a sense of, the developmental stages and understanding. And like you said, not everyone is niched down or able to work with children, where if you go for counseling, typically you go for general counseling at as a track. That's a very common track, and then you specialize after you do generalized.
That's correct.
Yeah.
That's correct. So it's been very fulfilling journey for me, and I still am excited. Waking up in the morning and looking forward to the day. It's just a really beautiful, I would say beautiful field, but it's you have to be dedicated. You have to really like what you're doing, and but it is fulfilling and rewarding at the end.
Yes. Isn't that true? It's so rewarding to be able to see people change, and to be able to find health and hope. And what a wonderful gift.
Well, but don't get me wrong, not everyone is a success, because there are some of the patients that we'll deal with that, at the end of the day, they continue to suffer. But I think for the most part, it's such, for me, it's such a very interesting and rewarding field. And I am so happy that I'm doing what I'm doing.
Well, I'm so glad. So, okay, let's talk a little bit about this topic of when to consider seeking services for your child. So, first thing, can you distill down kind of like the field of psychiatry and child psychiatry specifically. You said that finding a child psychiatrist is really imperative if you're looking for services for a child, because they understand developmentally differences versus just an adult psychiatrist or a generalist. And then as you're talking about that, can you also share about when a parent should consider seeking services from a child psychiatrist versus a child pediatrician?
Well, pediatrics and child psychiatry, we interface. In fact, they are major referrals for us. Now, what's the commonality between pediatrics, the field of pediatrics and child psychiatry, would be the age group that we treat with, infancy until age 18. Although for some practices, sometimes they go up to 21. So with pediatricians, they deal with well baby and sick babies, but they also work with problems with behavior and mood and development, but they also deal with other conditions like headaches or stomach upset, and so they cover a lot of physical illnesses, but including well babies. They do vaccinations, they educate parents, and whereas with the field of psychiatry, we're more focused on areas of emotion, mood, behavior, delays in development. We deal mostly with, should I say more complicated cases of even attention deficit hyperactivity disorder, depression, anxiety, autistic spectrum disorder, post-traumatic stress disorder. A lot of those areas, our colleagues choose to refer to us because they, in addition to some of those areas, they also deal with a lot of other illnesses in their practice. So whereas the population is the same, we're dealing mostly with challenges and problems in mood, behavior, development, as I said.
So then, if a parent is concerned about, let's just make up a scenario, their 5-year-old who seems to be suffering from more anxious behavior, is really having a hard time in developmental emotional age, would they seek their pediatrician first and then get a referral to you? Or can parents who know their kid is dealing with anxiety or are curious, can they just give you a call or a child psychiatrist a call?
Well, unfortunately, there is still some stigma as far as seeing a psychiatrist, whether adult or general psychiatrist. And so most of the time, parents would probably go to their pediatricians first to get some consults and advice as to what they need to do. Or they would seek out a therapist like you because that's probably more comfortable for them. And that is okay. That is, nothing wrong with that. But at times, we see some of these children and adolescents that have been going through those challenges, those difficulties for years before they come to us. But you have to go with what the parents are comfortable doing, and a lot of our colleagues, pediatricians and therapists, know when to refer, and as much as I think sometimes it really would have been in the child's best interest to have been evaluated right away by specialists. Sometimes that's hard to come by,
Yeah.
and so it depends on how maladaptive, how dysfunctional, how symptomatic the child is, and of course, mild, moderate, severe. If the symptoms are so problematic that, for example, the child is unable to engage at all with the siblings, with the family in school, then as much as we would like to do an assessment right there and then, most of the time we don't. They usually seek out other specialists, and most of the time they get the care, but it depends on what they have. That sometimes they get better for like few months, and then the symptoms resurface with more issues or more difficulties. So it really we work a lot with all these different with various specialties, but as much as we wanted to be able to get the assessment, then usually parents are not comfortable and they wait and seek out other specialists and or other people.
And so, I know that as a parent myself, like it can feel like there's a stigma, right? If you're like, oh, my child's struggling and there's something that I don't know what's going on, and I struggle with anxiety, and maybe I should see a psychiatrist, but what is it going to be like? So I know you mentioned earlier that you don't always medicate. So tell me a little bit about what psychiatry is, so kind of like uncover the misinformation.
Yeah, they think psychiatry means medication.
Right, because parents often are, if I say, hey, it would be helpful to maybe seek out a psychiatric assessment, they're like, I don't want to medicate my child. I don't want to medicate my child. And one thing that I really appreciate about you is that there have been numerous times when we've interfaced and there's a recommendation for something like increased omega-3s and vitamin D and these types of things. But help us understand as parents what you actually do in an assessment. I know we didn't plan on talking about this, but I think that it might be really helpful for people to understand really, like, it's like going to the doctor, or is it? Is it like going to the doctor where you don't always get medicine, you don't always get an antibiotic, you don't always get a pill?
Well, our assessment, Susan, is anywhere between 90 to 120 minutes. So that's an hour and a half to 2 hours of assessment. And what we cover during the assessment will not be only on the symptoms that present to us. We need to know, so we go over family history, we go over medical history, educational history, developmental history is so important. How, what was your pregnancy like? What were there issues there? Were there challenges during the first year of your life? How was speech? So there's so much that go into the assessment, and in addition to evaluating the severity of the symptoms, how are these symptoms affecting the child's day-to-day functioning?
Yeah.
How is it affecting the relationship between this child and the family? How is the child? So, of course, depending on the age, and some of the. So I was talking about diagnostics, which is really, really important for us, because how can you have an intelligent, comprehensive knowledge of the child if you're spending 10, 15 minutes, even an hour, I mean, there's so much that goes into it. And at the end of the evaluation, it does not necessarily spell out medication. Most often, I would look at referring the child for some form of counseling, whether it's cognitive behavioral therapy or some form of psychodynamic therapy, or coaching the parents in terms of how they, how they choose to quote unquote battle, how to prioritize what they're dealing with. So it's not just really treating the child; it's also working with the family, and as often working with the school and other systems involved in the child's life at the time.
Yeah, because if it's affecting their day-to-day and the relationships that they have and their ability to continue to develop in a healthy way, obviously what you're recommending can span a huge spectrum, correct?
Correct.
Yeah.
Correct. Yeah. And sometimes it's really, the child is presented as a problem, but, I am never a parent basher. I believe that parents have great intentions and want their child to succeed and do well. But at times, it's really also when we're evaluating the child, we're also evaluating the parents' mental health. How are they able to deal with the daily challenges sometimes that the child presents to them? It is hard. I mean, you try to put yourself into the parent's shoe, and it is tough at times.
Yeah.
So even if the child is the identified patient, we really look at the entire system.
Yeah, I think it's so helpful, and not to make parents afraid, but what a wonderful holistic approach of looking at the system and seeing where we can aid, resource, support, help. Like you said, if there's holes, there's this sense of not just here's a Band-Aid or here's something, after seeing a child for 15 minutes. So my goal is that these parents that are listening to this podcast can be assured that a good child psychiatrist is going to take that time, is going to look at what's underlying, is going to uncover stones, is going to look at the developmental processes and where things may have been challenging and how we can move forward.
Well, yeah, I think I've always believed that it is important to take into consideration the dynamics in the family. I really find it hard to treat a child or an adolescent without having to connect with a parent. I do respect confidentiality, as much as, we have to make the child comfortable when we see them. But it is also important to have knowledge of what else is going on that the child may not be picking up or the child may choose not to discuss with you.
Sure, yeah.
So I find it sometimes amazing that that some of our colleagues would only see the child and not want to talk to the parent. I really don't know how you can accomplish your goal of stabilizing what's going on with the child and the home without getting that extra information that only a parent would be able to provide you, or not having to dialogue with the school. So as you say, Susan, I really believe in the systems approach as a child and adolescent psychiatrist, that I could not really work in a vacuum, just seeing the child.
Right.
To me, it doesn't really make sense.
Yeah. And in that, I really appreciate that perspective and that approach. And that's the way that, we at Kid Matters, myself and my team, work with counseling as well. We're working with the system. We always are coming alongside, journeying with the parent as well, because they have to have things that they too can utilize and support the child as we're working with them, so that there can be changes, because the parent's there. The parent's the
Right.
one that's interfacing most of the time with the child.
And sometimes the parents can use the support, the education,
Yeah.
the contact as much as the child. And so
True.
recognizing that is so important from day one. I mean, we emphasize the initial evaluation, but I also believe that our knowledge expands as we know the child. Follow-up is very important. Compliance in terms of the recommendations. But you probably won't. I always say changes will not occur overnight. And the more knowledge that you have about the child, the family, the entire systems around the child, the better you are as a therapist, as a healer, as a physician, as a team member in this child's development
Yes.
and success.
Oh, I think that's great. Okay, I have a few more questions. This is really great. I just want to remind our listeners, though, that the topics discussed on this podcast and the resources shared should always be considered a matter of personal opinion. They do not reflect professional advice. If you or your child is in need of mental health counseling support or psychiatric support, please search out a licensed professional in your area. So, Dr. Bernardino, tell our listeners, what are some of the top signs that a parent or a guardian should be keeping an eye out for while they're with their child, while they're interacting with their child, that might be a way for them to see, or an opportunity to kind of like just begin to question or seek psychiatric care?
The key word would be change. Now, knowing the baseline of the child,
Okay.
and if the child presents with changes in mood, behavior, engagement, specifically a child who, or adolescent who from out of the blue would present as angry.
So you're not talking
irritable.
about change like, right, we just have gone through 2 years of a pandemic and there's a change, right? That kids aren't seeing their friends, that they might be sad about that. You're talking about
It's-
out of the blue.
Whether situational, environmental, or random, specific changes that are just out of character for the child and persistent.
Okay.
Persistence, severity, duration.
Persistence, severity,
and duration. So, the persistence of irritability, anger, moodiness, aggressive behavior, or the opposite, being quieter than usual, wanting to isolate himself or herself. Someone who used to be outgoing and then all of a sudden would not want. So these are the changes that I'm talking about. Children and adolescents don't tell you I am depressed. They don't tell you I'm anxious. Most of the time they don't. But a child who, for example, starts not wanting to go to school and complains of, I have a stomach ache, I have a headache, I don't feel right. Because those could be medical issues. It's true that you have to factor in having to see a pediatrician, but they are also common sign of depression or anxiety in a child. Or someone who used to be a good student, and then you notice indifference to doing homework, or the grades, you can see the grades that are different, or changes in the way they wear their clothes. not one, so all of these taken together, and the key that I talked to you about, and of course you're not going to react with someone who just present like this 1 day, 2 days. You're talking about several days and weeks of a mom, scratching her head and saying, what is going on here? I notice some of these changes. So the change would be very important.
So persistence, severity,
duration.
and duration. So let's just as a real life example, a 5-year-old, they're typically really happy. All of a sudden, they don't want to play with their friends anymore. They're hitting things. They're banging their head against the wall. Mom notices it. She's like trying to figure it out. She goes to her pediatrician. Is like, is something going on? What would you say is happening? I know you don't know this, the system, the case, but like, what would you say is happening if it continues over? Would you say look at it for 3 weeks? What's a persistent behavior in a 5-year-old?
Well, you try to monitor that and give time, but if there are some concerning behaviors in addition to what you mentioned, especially, a 5-year-old, it depends on the language sophistication of the child. Some 5-year-old will be able to tell you maybe, what's going on, if it is situational or if there are some issues with their peers. But if they themselves don't, if they don't say anything, it's not because they don't want to, but they probably don't have the language to describe what's going on. So you go over the history. Is there any family history of anxiety among parents, siblings? So is this behavior out of character for the house, for the family?
Household.
Yeah.
Okay, yeah.
And what other changes are noticed? Are there some issues with sleep? So I'm talking about the evaluation that we go through. Are there some changes in the child's eating pattern, engagement with other, with other children and adults? We choose to, for someone very young like that, you wanted to gather more information, and that would be an example of what I would say, forget about medication. This medication is not the primary intervention here. You wanted to know what's going on, and most likely that child, I would say, would require a referral for individual and family therapy, whether play therapy or a combination of talking therapy, play therapy, parent coaching. That probably would be what I would emphasize and what I would suggest right off the bat.
That's helpful. That's really helpful to know, because I think that when we're when I provide coaching to parents in treatment with every child, I think the biggest thing for me is to help parents to notice what is going on, and to not just think any behavior or presentation is showing up in a vacuum. So I appreciate what you said, is that, like, yes, you're looking for these specific, persistent, out of the blue changes, but you're also then looking, hey, and I feel like we're very aligned in this, is that if a parent can think about, is this, have there been any big changes in the house? Have there, did all of a sudden a sibling, get a new bedroom, or go to school, and this child is, now in a different classroom, or have there been any big major changes, or are these specific patterns that have happened in your home, or are I don't want to use the word normal, but they're something that a child has been exposed to, like anxiety or a behavior like they're presenting with, it's helpful to look at all of that as well as what's developmentally normal or on par with growth.
Exactly. And thank you. You know, while you were talking about what's going on at home, I'm reminded of the importance of reminding myself, us, your parents who will be listening to this podcast, that children and adolescents are very sensitive to how their parents feel. They mirror, as much as parents mirror how their children are feeling, children mirror how the parents are feeling.
Yeah.
So if there is high anxiety in the household as a result of any factor, medical illnesses, financial stressors, relationship issues with parents, kids, believe it or not, pick up on that.
Yeah.
They know they know that you're not well. They may not understand what's going on, but these kids are very sensitive, and they know.
It's like I like to describe it as like, the soil of in which something grows is really important. So I like to garden because it's a fun way for me to release stress. But like it's important to know the soil type and the zone before you plant something in the ground, because otherwise it might not grow like you anticipated. And so if we're thinking about, and I know it's not a one-to-one analogy, but if I want to grow something, I can that isn't necessarily something that is native, I prep the soil or I prepare or do certain things and I take good care because the soil provides like mirroring, not again, this is not one-on-one, but the sense of, it's a breeding ground for the development. And it's important to allow parents to realize that the breeding ground matters, not just the type of plant, or that they have, we have a child and we gave them all this opportunity. Well, what's underneath also matters.
Totally. I agree. Yes, it is it is important to, I like your analogy. Thank you. I have to remember that. I'm going to use that.
But I think too, like the mirroring, what's fascinating to me about neuroscience that has really, I feel like, opened up the field of mental health to have wonderful support in many ways, in the counseling field, about like how we're mirror beings and how our what we do in our interactions and how we grow and develop has a lot to do with what we're sitting in front of or who we're with or our situation, and has shown a lot. And I really appreciate you mentioning that, the mirroring, and how you're taking such care to look at everything holistically. Your patients are very, very blessed to have you.
Well, thank you. Thank you, Susan.
So before we end, I would like to just ask if you can give our listeners some practical things to take away. So maybe 1, 2, or 3 ways that you might suggest that parents or guardians or whomever is listening can come alongside their children at any stage of their development and promote increased mental health.
We touched on the first one already. I think it is important that parents take care of themselves. It is important that you are well because of the mirroring that we already discussed. If you're overwhelmed, anxious, depressed, children will know that.
Yeah.
And so whether it's a 5 or 10-minute break from the day to take care of yourself. I think that's very important for a parent, a caretaker, to first be able to take care of yourself. And then secondly, I think it's important to provide routine and structure. It provides security for the child, safety and security for the child, no matter how busy we are, to get, to try to maintain a routine. It doesn't matter whether a child has ADHD, depression, anxiety, or developmental issues. I think it's just important to have to start the day with some specific programming or some activities. Active listening is important. Adolescents always tell me, "Oh, my parents think they know what I'm thinking." Well, I think most of the time parents really know, but it is important for the child and adolescent to feel validated, to feel that you're listening to them. So it does not have to be a whole 1 hour of sitting down. Sometimes just to carve out a few minutes of you really, I call it active listening. And sometimes really not saying anything. It's just being there, and the child knows that you're there and would be and is available to listen to what may be going through going on with them that day. So I think those are the main one. Routine, structure, active listening, taking care of yourself. We get so busy with our lives that things don't happen automatically. Most of the time, we'll have to create a space to do some things. And I know it's easier said than done because we are all very busy in our profession. But I always, again, one of the things I always tell parents, your children, they are your biggest investments. So
So it's important to actually do these things instead of just not think. Again, it's like you can buy the best plant and have the worst soil. And it won't grow the way you want it, right? No. So it's important to cultivate both, to get good plants, but also to, again, the analogy does not go 1-to-1. I think this has been great. It's been so helpful to hear. I think it's also challenged me to think even more about how to actively listen with my own children. I'm like, okay, what are ways that I can actually continue to cultivate that? Because I, like you were saying, sometimes think, oh yeah, I do that. But do they feel that? Do they know that I'm there? Are they aware that I'm carving out that space? And yet it doesn't have to be an hour, during the day. It can be a few moments. It can be creating these intentional practices. And in that, I find personally and professionally that the parents then are able to get that baseline, and so then they're able to see or anticipate if their child is moving towards depression or anxiety, and be able to manage it before it gets out of control. Would you say something similar? Or?
Well, I agree. I think it's there's always little hints, signs and symptoms there that usually parents are aware or sensitive to them. And I always say, it's better to nip them in the bud. I think a lot of my suggestions, Susan, I realize they're very basics and most parents already know them, but I think it's nice to be reminded once in a while.
Totally. I think so.
And I think important.
But I think that basic is important because so often we forget that. We want the high, here's the 12-step plan or whatever. But really thinking about what are intentional, small things you can do to affect change over time. And really, our mental health isn't something that changes overnight. It's something that is cultivated and grown, whether and there's all different types of reasons why, right? But also being present for our children and also taking care of ourselves as the adult, as the caregiver, is super important so that we can be with our child whatever they face in the future.
Well, thank you for saying that, Susan. I really enjoyed being here with you. I've learned a lot from your comments after my comments, and I really, I admire you. Thank you for the opportunity.
So, if people are looking for a child psychiatrist in the Chicagoland area, are you accepting new patients? How can people get in touch with you?
Yes, I am. And I have another colleague who's also a child and adolescent psychiatrist, and we're both board certified and have practiced for quite some time. So they have to call the office. My practice is in Burr Ridge.
Okay.
It's called Cypress Professional Group.
Okay. And we'll put a link to that on our show notes so that people can find that if they're looking for it. And so you say just go on the website, and that's the best way. It'll give you directions on how to get a hold of you by calling or emailing?
Yes,
Okay.
That's the best way.
Okay, great.
But
Yeah.
thank you.
Okay, well, thank you so much for joining me today. And to all of you who are listening, thank you for joining me. If you have a question for us that you would like answered, you're welcome to send it to podcast@kidmatterscounseling.com. And if you found this conversation useful, don't forget to subscribe, and please join me again next time for the Parent Matter podcast. Don't parent alone.